to save time and money, they would just set up shop overseas. Then they can, sidestep this requirement. That's why there's this myth that stem cell therapy is not allowed in the US. It's only not allowed if you're half manipulated the cells and you're not registering for a study. But what I did in the field is that I put everything together from the same donor. So I'm getting cells from the umbilical cord blood, from the umbilical cord tissue, and from the amniotic membrane.
Hi, welcome to the Dr. Joy Kong podcast. My name is Dr. Courtney Gillenwater. We're going to flip the chair today and have the honor of Dr. Kong as our guest here today on the show. She is a triple board certified physician, also the founder of the American Academy of Integrative Cell Therapy, and she's here today to answer the questions that a lot of us have at home, and we're going to see what she has to say to help answer our questions.
Thank you, Dr. Courtney. I appreciate you being here, and we're going to have some fun chat today.
Yes. So we'll get right into it. Something that has been on a lot of people's minds is when they're considering stem cell therapy, when people are trying to decide where to go, what are some differences that you think there are between stem cell therapies that exist, in other places as compared to here in the United States?
Yeah. Well, first of all, I'm so excited that you started by asking when people are considering stem cell therapy, because that means that people have realized how powerful stem cell therapy can be, that it can be really helpful. Because when I started in the field 8 years ago, the question was, what are stem cells? Why can't it help people? Like, what does it do? So the fact that we've moved to the point where, if people are considering, what are your advice? So I love it. There's a lot of confusion about, can I do stem cell therapy in the US? And what's the difference between what's going on in the US and what's overseas? So this is a huge area of confusion. I want to kind of dispel myths in this arena, because I can't stand half-truth or untruth. The fact that even some doctors are telling people that stem cell therapy is not legal in the US, it just, it's mind-boggling, and still it's persisting. So I like to just, let people know stem cell therapy is absolutely legal. First of all, it's in a gray area. FDA did say that yes, you can do stem cell therapy in the United States when you use it for hemoreconstitution purposes. So that means if somebody's blood lines are not good, you can wipe out their blood lines and give them new stem cells to replenish. So that's the only FDA indication for stem cell therapy. So in that sense, yes, there's an approval, but there are a lot of different kinds of stem cells. And are they allowed in the US? What about things from a person's own body, from their fat, from their bone marrow, or from the umbilical cord? What is legal, what's not. So the FDA made it simple. I think it's 2017. It basically said, okay, so if you want to produce cells that have not been altered in any way, I'm taking it from one person, whether or not it's from the bone marrow or fat or umbilical cord, and then put it into another person. In that process, I did nothing but mechanically separating the cells out. I didn't add enzymes or chemicals to change the structure or function of the cells. I did not grow them in culture to huge numbers. Then the FDA says you are giving a transplantation. You're not making a drug. If you're not making a drug, then you can do what you do as a doctor when you transplant, any organs, right? So we can transplant liver, lungs, heart. We can do all those blood transfusions. We don't need the FDA to approve such transplantation. FDA has nothing to do with it because it's regulated by the body of, the political body, or, the governing body of the medical association, the medical board, because they supervise how doctors practice medicine. The FDA is about products, it's about drugs, it's regulating drugs. So if you're not making a drug, then really it doesn't have a whole lot to do with FDA. There are certain standards you have to adhere to, which are governed traditionally by American Association of Tissue Banks. So they are the governing body for any transplantation. You have to screen for certain infectious diseases. There's a certain process that you have to go through in order to bring something from one human to another. So that's the difference. So if something is tissue transplant, then as a doctor, you can do transplantation, and that's what we're doing here. And there are a lot of doctors, actually, more and more, even though there's no ads, somehow there's some kind of censorship that certain therapies are not deemed as the right therapies, I guess, by big entities, big media entities like Google or Facebook or Instagram, that they don't allow doctors to advertise for stem cell therapy.
Oh, okay.
Because they think that's equivalent to miracle cures. Never mind that they have not reviewed all the articles, the thousands and thousands of studies from around the world showing how stem cell therapy can be helpful. Way more studies than the majority of the drugs, right? It's been studied just, to a tremendous degree. So these doctors who are doing the therapy are doing tissue transplant. But the moment you start to extract, after extraction, if you are using enzymes, sometimes they use enzymes to free the cells, but that's considered manipulation in the FDA's eyes. Or if you're growing them to huge numbers, which a lot of the overseas clinics do, because they want to tell people they're giving them a lot. So there's earlier research that were based on a particular number of cells per kilogram of body weight, and that's why that there's this tradition of using this large number of cells. If you want to do that, the FDA says you can, but you have to do studies. You have to apply for an investigational new drug study, which is IND, and that is a long process. It's very costly, takes a lot of energy. You're welcome to do it. But most companies realize how much of a barrier that is. And to save time and money, they would just set up shop overseas. Then they can, sidestep this requirement. That's why there's this myth that stem cell therapy is not allowed in the US. It's only not allowed if you're half manipulated the cells and you're not registering for a study.
Okay. And as far as for, different types of conditions, when you're thinking about, treating different kinds of conditions like, a lung issue versus a joint issue versus a brain issue, what are your thoughts in terms of stem cell therapy options for the people out there considering, how they can maybe benefit?
So different organs definitely require different approaches. Access is a main issue, right? Can the cells get to that tissue? But even when cells cannot get to a particular tissue, doesn't mean that the cells are not exert benefit. This is what's fascinating, because in the beginning stages of stem cell therapy, since the 1960s, when we did the first bone marrow transplant, the stem cell field has evolved a lot. The old thought was, we need to put the cells where it can grow new tissue, right? If we're trying to repair the lungs, let's put in the lungs so the cells can become new lung cells. Same thing for the heart or any other tissue. And then they realized with all these studies, they were giving people or animals certain stem cells, and then they saw recovery of damaged tissue. And then when they actually look at the damaged tissue to see how much of the repair of the new cells were from the stem cells, almost none. There's very, very little. So this is being consistent over and over. If it's ad nauseum. When I read studies, like, oh my God, same thing again. Okay, the benefit we saw was not a result of the direct differentiation of these stem cells. It's actually a result of the paracrine effect. So paracrine means signaling, sending out signals to neighboring tissue. So that's what the cells are doing. So there's systemic signaling and local signaling. That the systemic signaling, it accounts for part of the reason why, even if the cells do not get to a particular end organ, it can still exert benefit because it's interacting with your immune system. But the cells can also travel to a particular area. Let's say your lungs, there's inflammation, injury, or heart. The cells will be attracted to those signals emitted by the damaged cells. And then once the stem cells get to those areas, then they can send local signals. The local signals, one is telling the immune system, hey, we've got problems over here. Come bring your armies. Let's attack this problem right here. And then it's also going to send signals to the local stem cells. But let's say heart, their heart stem cell, muscle cell, their heart muscle cell, stem cells. So those are the end stage stem cells. The only thing they can differentiate into is the organ tissue cells. That's the only thing they can do. Whereas other stem cells can become many, right? Mesenchymal stem cells can become, bone cells, cartilage, fat. They've shown also can differentiate into nerve cells and, even liver cells. So they can differentiate in multiple directions. But when you have an end stage stem cell, that's all they can do is to go in one direction. So these stem cells, for example, mesenchymal stem cells that we use most frequently, those mesenchymal stem cells can tell the local end stage stem cells, hey, you differentiate. This is why you can't, it's really hard to find the stem cells you infused becoming the local cells, because that's not their main job. Their main job is to tell the local stem cells, you do it, right? I'm the director here. I don't need to put in the work myself. I'm doing my work. It's different from yours. So so knowing that, right, that there are these different signaling functions, then we can design, how are we going to do the treatment? Because, for example, lungs, a lot of people say, if I want to treat other organs, then, the IV the access is a little bit problematic because the cells are going to be trapped by the lungs. And that has been disproven. Temporarily, yes, because the lung is, full of blood. That's an organ of, oxygen exchange. You need the blood to fully perfuse the organ. So by carrying a lot of blood, then you're carrying a lot of cells. If you have lung pathology, like COPD or some other inflammatory issues in your lungs, yes, a lot of cells are going to be trapped in the lungs. But if your lungs are completely fine and clear, within a few days, they're all going to travel out, and they're going to find other areas of your body that needs help. So, but the beauty about the fact that so much of cells get to the lungs, actually they also get to your spleen, your liver, those, and heart, those are very well perfused areas. But so much is going to get to your lungs. So if you have lung problems, we can just do an IV route. It will get to your lungs beautifully. And this is what we have done in our clinic, because the cells are able to travel to the lungs. Can you do nebulizing? Yes, you can, but in certain conditions, coating your lungs with cells may not be the best idea. So in those cases, we may do a nebulizing of exosomes. Those are nanoparticles. It's not going to clog the surface of your lungs, so you're going to be absorbed right away locally. So we can do that. And then another challenging area is the brain, right? Everybody knows about the brain, the blood-brain barrier. How do we get across the barrier? First of all, the stem cells, it is difficult for the cells to cross that barrier. But the mesenchymal stem cells are really cool because they actually have been shown to cross the blood-brain barrier. So they have the ability to squeeze. They're the good squeezers. So they're able to get themselves into the brain. But in our clinic, we also do something that helps open up the blood-brain barrier, such as mannitol, right? It opens up the gap junction. All of a sudden, there's more in and out of traffic because we're giving a lot of fluid, then more cells are going to get in. And there are studies proving that it enhances delivery of stem cells into the brain. And in addition, we can add something that's really cool, which is an intranasal method. So you can intranasally inject stem cells. You have to break the skin barrier, so you have to inject in your nose into the mucous membrane. Unfortunately, that's pretty uncomfortable, so I don't really like doing that. And there's a nice alternative, which is just to use exosomes. We can drip or spray exosomes into the nose, so the nanoparticles can be easily uptaken by the membrane and go across the cribriform plate and get to your nerves and go inside your brain. So we can always use that as an adjunct. So then that way we get to this hard to touch region. Besides that, in our clinic we have also incorporated laser technology. And using laser, we can also direct the cells. So that's third way. We have a lot of ways, right? So we don't want to inject into the organ because that's pretty invasive. We have more elegant ways of getting the cells to a particular organ. So it's really fun, right? This is a playground. This is why, this is a kind of cutting edge, because we are figuring out ways to get the treatment done and get certain results. And then another area that people are interested in knowing are joints, right? So if we're just dealing with tendons and soft tissue, that's no problem. We can inject cells right there. But if you're dealing with large joints like the knees or hips, well, the joints are bathed mostly in synovial fluid, and then there's blood supply outside a joint. The problem is if you're trying to fix problem inside the joint, if you're putting the cells in the blood, most of the joint is not getting the signal. So the outer 1/3 of larger joints, the outer 1/3 of the cartilage is nourished by the blood supply. So it can still help. In a sense, I've seen people whose cartilage regrew after IV stem cells. So because the cells are able to, the signals are able to touch upon the outer 1/3 of the joint. And there are stem cells in there. That means that they are triggered or they are prompted to divide and to make new tissue. So you could see tissue regrowth on MRI, which shocked the orthopedic surgeon that saw the imaging, because she had never seen that. She was like, I've never seen that in my life. Well, because you didn't have stem cells. I mean, that's pretty simple. So when we're dealing with larger joints, it's good to inject some cells right into the joint space, because all of a sudden the cells are there and then they can go to work. So the combination of the IV and the local injection, I think it produced the best results.
Oh, okay. Well, that's fantastic. I love hearing all of these different methods that you're pioneering and doing in your clinic. And if there was other providers, or people out there interested in learning from you, is there a way that they can, learn from you and kind of get the information and, kind of the how-to for the Pioneer's Guide for regenerative medicine?
That's actually what I'm passionate about, which is to get more doctors to learn how to do this, right? I can only treat so many people in my lifetime, but if I can get 100 or 1,000 doctors to do this, all of a sudden we are relieving so much suffering. I hate unnecessary suffering, because now we actually have the tools to get people out of suffering. Imagine to regenerate their joints, to not need any hip replacement or knee replacement, to emerge out of autoimmune conditions. We have an opportunity. We have the technology to do it. And if we're not giving it to people, then we're really doing people a disservice, as physicians and as healers. So I love teaching other doctors, which is why I founded the American Academy of Integrative Cell Therapy. So we already have an online course called Fundamentals of Stem Cell Practice. So that's a didactic course that talks about all the science, behind what is, exactly what are stem cells, what types there are, what they do, and also what the differences are between different locations where the cells are at, and we talk specifically about mesenchymal stem cells. And then we go into evidence, clinical evidence. That's what I care about the most, right? The science is great, but does it work? Does it work for this? Does it work for that? How is it going to help people? So I walk them through all these different organ systems and different disease categories, from autoimmune to brain issues, orthopedic, heart, lung, skin. So we go through different organ systems and talk about evidence. What kind of research has been done from around the world? And then we talk about different other factors that may affect stem cell therapy. What about medication, interactions? Could there be, what if you want to use adjunct? What about right light? What about other, sound technology? How do they interact with stem cells, and, will they be helpful? So these other arenas, and then what can you do to optimize the treatment? So that's the didactic portion. But I'm super excited that the Academy actually is going to start a certification program, and we're planning on doing the first training. It's a 2-day training course in July, right here in Los Angeles, and I'm very excited. Partially, I'm driven. I'm almost pushed to do this because so many doctors want to learn from me. They want to come to the clinic, and it's a lot of work to teach one-on-one. So if I can make this more efficient, right? I can teach everybody all at once, and people ask questions, and a lot of times one person we ask a question the other person didn't think about, and then they realize, oh, I want to know the answers too. So we can learn together. So we can really go in depth. So the first day will be didactics, of the foundation. The second day will be the practical training. So how do you do an IV treatment? How do you do different joint injections, other soft tissue injections? What about penis, vagina, and aesthetics, and then also certain things about business aspect of stem cell therapy, which most doctors are not familiar with. So I want to kind of give this, allow people to actually just take it and actually be able to utilize it, right? So if you miss certain aspect of this didactics and practical, or even the business, then you don't know what to do and how to actually bring it to people. So so that's coming up.
Oh, that's fantastic. And that, as far as for opportunities for people to sign up for that, where can they go to find to sign up for this July 2-day event?
Yeah, so people can always go to aaict.org. So that's the American Academy of Integrated Cell Therapy. They can always send us an inquiry. When we firm up a date, then we'll let them know. But definitely, I'm thinking July because the demand, people really want to get this going. So I don't want to delay it too much. So okay, we're going to do it in July. And also, I want to tell people that AICT is a great source for providers or patients, because not only, we have some excerpts of the studies, but those are nothing compared to what we cover in the course, just to give people a glimpse. There are a lot of research out there, but that's nowhere exhaustive, but just an example of what has been published. But we have case studies of real patients that have been treated with stem cell therapy, and then looking at what kind of conditions they had and what kind of results they were getting. So there's a wide range of conditions, which are mostly my patients, but also patients from doctors that I've worked with. So that's a really good resource if people want to check it out. I think it'll be an interesting read to see what people suffered from and what happened after they got stem cells.
Oh, I think that's going to be such a fantastic, very unique resource that is also going to be something that we can all build together, it sounds like, because if you're able to train and help kind of share your education with all of these providers, that means that all of them would be able to also add to all of these clinical case studies that you're sharing with everyone. And this is all in the United States, which is also, just kind of to highlight again, these are all people who you have helped here in the United States. And as far as for compared to outside, just what do you think this means moving forward?
Well, we do have, quite a number of international patients, people who fly into America to get treatment, partially because they trust the system in America, that we have more stringent, as far as the process of ensuring the quality of the products. And we've had international doctors who have trained with me as well. So I think we can be, even though it says American Academy of Integrated Cell Therapy, but I think we can help, everybody from around the world.
Oh, that's incredible. Is there anything else that you would like to share, with people out there listening right now that you think can kind of help people, who are looking between places outside of the United States and then looking here in the U.S.
Yeah.
Is there anything else you'd like to share?
So there's so much to share. So I have a lot to say about, a lot of different things in the stem cell arena, because I've been in this for 8 years and I've seen everything that's going on in the field. First of all, the myth of having to go overseas to get stem cell treatment, that's just not true. I think you can get just as good of treatment, if not better, when you stay in the U.S. Well, of course, it depends on who you go to, what kind of provider you go to, right? What kind of products are they using, and what kind of training have they had? Because there are, unfortunately, some doctors who heard from a rep from a stem cell company telling them you can make a lot of money doing stem cells, and this is what you can do, this is how much you use. And so they don't have a background knowledge. They just know they were told to put this into the, into the syringe, and they can make a lot of money. And that's really not the right way of approaching medicine as a physician. You don't take directions from a pharma rep or a tissue bank rep. You want to learn your basics, understand why and what you're doing for the patient, and learn all the techniques behind, around it, because so many are doing the wrong things. They are giving people IV infusions, and not through an IV bag, but doing an IV push, which can have serious problems of embolism, because not only the cells have a tendency to aggregate and form balls, so when you put them in a concentrated syringe, you're not breaking them up with the IV blood filter, then they can really cause embolism. And also you're concentrating the cells so much. Mesenchymal stem cells have a tendency to cause hypercoagulation when they're too concentrated. So now you can, increase the chance of clot by giving people the cells in too concentrated a form. So these are just two simple principles that unfortunately most doctors are not doing it right. That's why I have an academy. I really want people to do it right. So that's one thing, knowing your doctor, having had the right training, and is using the right product. What kind of product are they using? Are they using, first of all, if they're using your own cells, if you're young and healthy, I think there's a good chance that can be very helpful. But just know, the moment you take your own your stem cells out, and you have activated them, when you put it back in the body, they're ready to work. So once they have been activated, there's a finite lifespan. Once they finish their work, most of them will die, and you have just lost some of your stem cell supply. So just know that. Not to mention, if you get older, if you have any kind of disease, the cells are going to be less potent. So they will have accumulated more genetic changes, more toxins in the cells. They would have lost certain functions, and this has been proven over and over again. Their telomeres are shorter, their capabilities to differentiate is less, they are less able to secrete all these signals to promote changes. They're also less intelligent. They cannot, oftentimes they've lost the capability of recognizing cancer cells. This is why when we get older, the cancer rate is getting higher and higher. Your body is not able to mount an attack. It's like, oh, okay, I see you, your cancer cell. I don't know what that means. So, but if you are a umbilical cord stem cell, very early stem cell, the moment you see cancer cell, you know, okay, there's something really wrong with you. I think you should not exist. And they can send signals to get the cells to go into programmed cell death. But your own stem cells are just chilling with you, getting old together and not really realizing there are things that it needs to do. And so when you getting those cells out, hoping those cells are going to help you to fight cancer, good luck. Sometimes it's going to make the cancer grow because it hasn't lost its ability to secrete factors to help things grow, but it has lost certain capabilities of recognizing cancer. So knowing that that's a risk you're taking. And this is why I'm not doing a person's own stem cells, because of that concern. And if you decide to use younger cells, which will be umbilical cord, that's the most popular, umbilical cord stem cells, ask your doctor, are you using umbilical cord blood cells? Are you using umbilical cord tissue cells? These are the two big camps. They're also amniotic membrane stem cells. What's interesting was that I've used all of them, and I've seen research studies on all of them. They all work for something, but not for everything. So what I did in the field is that I put everything together from the same donor. So I'm getting cells from the umbilical cord blood, from the umbilical cord tissue, and from the amniotic membrane. Because I always say God created, all these cells for a reason, right? And who am I to play God, thinking that I can just give you one of those cells and that's going to be good for everything, when research study has shown that nothing is good for everything, and they do work together. There's synergistic, there's a collaboration going on between the cells. So I'm bringing all these different cell types. So not only we have a large percentage of mesenchymal stem cells, we also have all these other cells from the umbilical cord blood, which are hematopoietic progenitor cells that can originate all the bloodlines, right? It's great for brain health, great for angiogenesis, that means forming new blood vessels. And we also have endothelial progenitor cells, which help repair your blood lining, blood vessel lining, right? That's crucial for health of your entire body. And it also contains all these mononuclear cells, so very primitive immune cells that can help rejuvenate your immune system, which is crucial in how you can fight disease and cancer and aging. So when you use umbilical cord blood cells, you're incorporating all these cells. There are also some mesenchymal stem cells, very tiny fractions. This is why we're using umbilical cord tissue and amniotic membrane mesenchymal stem cells. We just call them MSCs. So these MSCs from the cord tissue or amniotic membrane or the cord blood, even though they're all called MSCs, they're all different. They can secrete different types of growth factors, and they can differentiate into different, organ tissue pathways. So they're not the same. So if we can harness the powers of all these different types, then we have a very comprehensive product that different cells can work together. I think that's why we're seeing such a good success rate in our clinic.
Oh wow. And so that's, for your product, when people are comparing, your product to other products out there, this combination is just, the potential for healing and for everything that, what else makes your product, different from all the other products out there?
Yeah, so we also have an exosome product, which I think is the best exosome product there is in the country. So exosomes has become popular. Some people are so confident. They say that now we have exosomes, we don't need stem cells. And that is just very misguided statement, because stem cells is what made exosomes. And so you can't just say we only need the children, not the mothers. So the stem cells contains the DNA that knows how to respond to the environment, knows what kind of exosomes to produce for a particular situation. So when we give people stem cells, the stem cells can target, secrete exosomes. So that's important. And the stem cells can also be attracted to the area that you need help with and then secrete exosomes. That said, exosome products are very helpful. And I think it's a great addition because they're nanoparticles. So these are tiny, tiny particles that the stem cells secrete into the environment, and it can signal, all these other cells on what to do. It has microRNA, can actually go across cell nucleus and help repair the DNA. So the exosomes contain some really powerful stuff. So in our product actually are obtained from the amniotic fluid. So imagine the fluid that bathes the baby. It has all these, incredible signals to help the baby to stay healthy, and so it's full of exosomes actually and growth factors. So our products contain high concentration of exosomes and some larger extracellular vesicles that contain a different growth factor profile, and also contains just a free floating free agent growth factors from the amniotic fluid as well. So it's a product that everything is included, all the beneficial components of amniotic fluid. And we also optimize the mothers, donors, before the end of their first trimester. So the mothers, we're not going to accept them to donate the birth tissue unless they have gotten on certain diet and exercise regimen and taken certain vitamin regimen that we prescribe. So that ensures the health of the pregnancy. And then we have some other methods that make sure that the processing time is really short and it's cold processing. So that's why the potency is so high. So it's a lot of fun, to have, to be able to provide the best products to really expedite healing.
That's incredible. That's so exciting to be on the forefront of that. You must be so proud. Is there anything else that you would want to share with the people out there that are considering, what kind of options they have for healing and therapies?
Yeah, so definitely do your research. Make sure that your doctor has your best interest in heart, right? This is not just about making a living, making money. Really caring about the patient And I think an integrative approach is really important. I personally don't trust a doctor who just say, oh, I give you stem cells and let me just put the stem cells in you and I'm done. I charge you a lot of money, I'm done. No, you've got to prime the body. You've got to prepare the body. Otherwise, you're putting like beautiful seeds into dirty soil, that's full of toxins, right? So in our clinic, I make sure that people are taking certain supplements to make their body less toxic, right? We get rid of more toxins and deliver more nutrients so they have all the ingredients. It's like you're trying to make things. You're trying to make new tissue, make a new self, right? We're trying to create a better self for you. So you want to get rid of the toxins and bring in all the nutrients that are necessary. Open up your blood supply. Nitric oxide is something I use to open up the blood vessels, and then there are other herbs that we can add to really enhance how much stem cells is circulating in the body, and to keep them coming, right? So we can give stem cells, but we don't want them to just go back to the bone marrow and rest. We want them to keep circulating. So there are all these things we can do. We also do ozone therapy right before stem cells. So we're super oxygenating the body. We're activating their antioxidant system, boosting their immune system, making their red blood cells more flexible. Basically we're amping up the system and detoxify it as well. And then we're putting these beautiful cells. And then you want to be able to look at the body as a whole, respecting how complex the body is, and not have the arrogance, which is what I didn't like about the traditional conventional medicine, which is the arrogance, saying, oh, the body, you have this issue. So if I just give you this drug, then you're done, you're fine. You're not looking at the other 500 factors. We may not be able to look at the other 500, but at least look at 5, right? As doctors, look at something instead of just, oh, you have this, so let me give you a drug, which was how I was trained. And that's how you were trained.
Yes.
So that's why we're breaking out of the mold, because we want to do the right thing.
No, that's incredible. And the opportunity to learn from you has been life-changing for me. So I just would like to thank you so much for all of just the education and inspiration as well, because I think if there's a way that you were able to help me learn more, that means I can only imagine how many more people you are going to inspire and be able to educate in the future. So I just really look forward to seeing what the future has to bring, and thank you so much. And I just, if there's anything else you'd like to say.
Yeah, well, I'm probably the most excited. I love teaching doctors. I'm the most excited about hearing people's success stories. So I want to teach you, and if you did good and used these amazing cells and you saw some incredible results, I don't think there's anything that makes me happier. It was like the biggest high. So yeah, so I want all of us to go out there, be the army that create these changes, that use these powerful cells that have almost no side effects. It's pretty incredible. Using nature's intelligence to heal the body. And this is the way of the future. So I'm excited to see, to help anybody who wants to come on board.
Thank you so much. This has been an absolute pleasure, and I'm so thrilled to be here. And I hope you guys all enjoyed this interview with Dr. Joy Kong, my personal hero and my inspiration.
Thank you, Dr. Courtney.